Good morning, everybody. Thank you so much for joining us on this beautiful Tuesday afternoon. No snow on the ground, no rain, at least not here in central Ohio. So we're excited about, I guess, the week full of dry weather. But that's not what we're really excited about. We're really excited about advocacy, aren't we? Let us go straight into what's going on at the State House. The State House is full of life. House Bill 248, which is the crush-proof medication bill, is going to have another hearing on April 20th, we've been told, possibly. And we're hoping that will take place. Basically, there is a sub-bill, which means the bill has been somewhat rewritten. The original intent, however, to allow physicians to prescribe basically crush-proof medications, so those who are trying to misuse prescription medications will not be able to crush it and snort it and use it for other means. That would be allowed to be covered by insurance companies and to be prescribed by doctors if there's a case where the doctor feels that the person might have a substance use disorder or a misuse, some kind of reason that they think that they might be misusing prescription medications. Right now we are asking that folks prior to the April 20th hearing, if people can get letters and phone calls to Representative Ann Gonzalez and the House and Aging Committee, I will send out a link after this call to, actually later this afternoon. I'll tell you why I can't send it right after this call, but in a bit. But wanted to get that link out so everybody can get information and some of the talking points to the representatives to get this bill out of committee and hopefully get this passed before the year is up. When this year is up, as many of you know, this is the year that all of the representatives will be up for election. And at the end of the year, we could have a whole turnover. We could have, everybody stay, a kind of a mixture, which is what it normally is, of those who are being ousted and those who are staying. And basically, all the bills go away. So we'd really like this passed before, actually before the House and Senate go on break, which we're thinking is in May this year. They will be campaigning, so they probably won't be back until after the election, which will be a lame duck session, and hopefully we'll get this thing passed and through the House and the Senate before then. Some of the talking points that we're really looking at, we want to provide coverage for abuse-deterrent opioid medications. This is how a lot of folks start with some of their addiction issues innocently, and it seems to have started here. We also want to reduce barriers to prescribing the crush-proof medications, and then we want to everything kind of the same as far as insurance-wise. So we want to give doctors the ability to prescribe these that insurance companies can't limit them. Yes, they are more expensive to cover, but if we can save some lives, if we can save some folks from going down a deeper road, I think the cost is well worth it. So we'll be sending out more information on that later today, hopefully. And I really do encourage folks to put that on your radar. Just a really quick letter or phone call to your representative and let them know that you support this bill. The reason I will, there's actually a meeting going on at 11:30 today. The Lieutenant Governor, Mary Taylor, is actually hosting it. And from what we are hearing, these are rumors, so if this doesn't actually happen, we'll somehow try to cut this from the advocacy webinar. But the rumors that we're hearing is that they're going to be an opiate MBR, which is a mid-biennium review Usually, an MBR is kind of is a bill where they take either savings or they adjust funding streams or funding opportunities and those types of things into a bill. It's an off-budget year, so they try to correct themselves and correct some situations that may have happened with the last budget bill. And they do this every off year of a budget usually. This is the first time I've ever heard of that they're attaching that they want to create an MBR based on any kind of substance. I've never heard of a cocaine MBR or a heroin MBR. This is an opiate MBR, and we're hearing that there's not any money attached to it yet. It is a policy document, so it will be a lot of policy recommendations. Some of the policy recommendations, I'm guessing, are going to be based on what the CDC released a few weeks ago, some of their recommendations to opiate prescribing and things like that. But we are guessing, and we're hearing that it will be released today. And there's also a lot of talk down here in Columbus that will there be a relabeling of the opiate crisis to becoming a public health crisis? And what does that mean? What does that simple little phrase mean? Basically, the health department will do more as far as funding. From what I understand, there will be more emphasis. There will be actually more ability to gain resources from both the state and federal government. So changing that from an opiate crisis to a public health crisis could open up a lot of avenues for more funding into the state for folks who have these issues, and also the entire crisis. Hopefully, prevention will be part of that. What this opiate MBR, some of the things that we've heard that are included in this, that they want to open more methadone clinics. I guess the state has 8 methadone clinics right now, and at one point the state had 20. So they have closed 12 in the last 20 years or so. They want to open more of those so that folks can get medication-assisted treatment. They also want to expand naloxone distribution. I have question marks because this is what we're hearing. These are all rumors at this point. So, don't go back to, your powers that be and go, oh my God, we've got methadone clinics all over the place. Let's make sure. I will send out an update along with my update 248. I'll send an update on what we hear today at this 11:30 meeting with Lieutenant Governor Taylor. But we also, again, we're hearing that they want to expand naloxone distribution so that folks can have it. A lot of first responders have it. They do want to make it more available to family members and friends, and anyone who might have need for it to make sure that someone does not die from an accidental overdose. They also want to limit opiate prescription. CDC actually listed last week, a few weeks ago, in their recommendations that opiates should only, the maximum opiate should be prescribed for 7 days, and for most cases, anything other than opiates should be tried as far as the less lethal pain medications, and usually they were suggesting that the folks should get a 3-day supply and at the maximum 7-day, and that's for folks with cancer and those types of things. So really they want to limit opiate prescriptions, and I think that's what the opiate MBR we're hearing will also do. I don't know how some docs will feel about that, but we'll see. There will also be, we think, some language around any Suboxone clinic that has more than 30 patients will have to be licensed. Right now in the state, you don't have to be licensed if you have more than 30 patients at a Suboxone clinic, or a physician that gives more than 30 prescriptions for Suboxone. And that would change to licensure, to having to have licensing for that. My guess is that this is to limit the just the over prescribing of Suboxone and those types of things. But again, these are all rumors that we're hearing. And then also that pharmacy technicians would also have to be licensed in the state. Right now, I think they don't have to have any kind of accreditation. They can get a certification, but they don't have to. They don't have to be licensed, and that would change with this opiate MBR. So we are, we're looking forward to what this actually has to say, and I'll try to get you the language and some of the highlights from these things or from this bill today. But if not, we can hopefully have it tomorrow, because it should be a very, very big document that we're looking at. Excuse me. Next is we have the CARA bill. An update on the CARA bill. This is the federal bill to deal with the opioid crisis, especially co-sponsored by Portman. It actually passed the Senate. It says should pass the full Senate. It actually passed the Senate. That teaches me for using the same slide as last time. But it did pass the Senate and is now in the House. They have attached $80 million in funding. Some of the conversation last time at the last SPECA meeting. If you miss a SPECA meeting, you miss a lot. So if you missed the last SPECA meeting, there was a great deal of conversation about this bill. Some of the issues, yes, there would be an increase in coalition funding. However, you have had to have received a DFC grant at some point, either be a current DFC grantee or have had a DFC grant in the past. And, there's a lot of great coalitions out there that do tremendous work that have never received a DFC for whatever reason. And so we have some questions about that. Also, the coalition funding would also be focused on coalitions and communities where higher rates of local opioid misuse is taking place. There'd be a national public awareness campaign, a lot of treatment and recovery dollars. They really want to focus on pregnant women and veterans and those children who are born into to opiate-addicted mothers. So there really is, a great deal. It changes an awful lot of the way that folks look at this, because there would be a national public awareness campaign that hopefully we would focus on addiction as a disease and not as a moral failing or some kind of choice that these folks are making. I mean, this is something that is devastating and uncontrollable when you are in the midst of addiction. And interestingly enough, I was at a meeting yesterday, and this disease is so rampant and so devastating that addiction is the only disease that we actually have to legislate to try to take care of. You don't have diabetes legislation. You don't have heart disease legislation. This is such a devastating behavioral health disease that we need laws to protect folks. It is such a powerful force that we really need to focus on that. So I thought that was an interesting point that person brought up. So this is going to go in the. Hopefully, we'll get a hearing in the House soon. They're trying to get 200 co-sponsors on this bill to get this thing passed. Paul Ryan said he would like to see it passed, the Speaker of the House, and but it's kind of crazy season with so many people up for election and a presidential thing and all of that. So we really do need to advocate for this bill, and hopefully we can have this thing passed the next in the next hopefully few weeks or months. We have marijuana that is starting to rear its ugly head again. The Marijuana Policy Project has a marijuana initiative that will be. They've approved they were approved by the ballot board to obtain signatures. Basically, they had to be approved by the Attorney General that their summary matched their language. They failed the first time, but it came back and They fixed whatever points Attorney General Mike DeWine had in the response letter. They fixed those. That does not mean that Attorney General Mike DeWine supports any of this. It just means that he has an obligation to make sure that the summary matches the document that they are touting in the language. So, and then the ballot, after that, the ballot board then has to obtain the ballot board has to basically make a determination that it is one constitutional amendment and is not several. So they did that. This would be one this would be one constitutional amendment. And this is the group that has money. The signatures are mostly financed. There will be some. They will be asking for some volunteer signature gatherers out there as well. Kind of makes you wonder if they're really serious about this. I don't. I'm hearing from some people. I'm hearing, oh my God, this will never. This will never actually get enough steam to get enough signatures, but then I hear from others that say, well, this is a somewhat a decently financed group, so and they usually don't fail when they go into states, the Marijuana Policy Project. This is a big national group that will finance this. They're the ones who they wrote and passed the Colorado law, the Washington law, the Arizona law. The campaign team are Brandon Linaw, who is he was actually on our side during the Responsible Ohio campaign. He has a brother who has epilepsy, so that's why he said he has changed. Somehow, though, I think the money might have been a little bit of a temptation. Also, Lee Roberts is a political director. He was named political director. He's an attorney out of Toledo. He's actually an attorney for NORML, the national organization to reform marijuana laws. So, he's their political director. I don't know how much political direction he has. I think he's mainly just kind of a pot lawyer. And then Aaron Marshall is the communications director. The information I could find on him was he was an Ohio State graduate, and I don't know how much political experience he has either. But what's interesting about some of these laws is, this is kind of especially when they do it through ballot initiative. This is just kind of the first bite of the apple. Just the other day, the House actually passed in Colorado a law to basically allow medical marijuana on school campuses. And I'm not talking college campuses. I'm talking about all schools, high schools and middle schools and elementary schools. Why? Because the kids that need medical marijuana would, supposedly need it during school hours. The issues with that, and no school has actually been in support of, well, there's actually one school that said they would try to change their policies. Other than that, the schools are saying we would lose our federal funding. We've been warned with this. Nurses, if they would have to distribute, would actually be considered felons because being a Schedule I drug, nurses would then be distributing a controlled substance to minors, which is never a good idea. So there's a lot of nuances to this, but again, this is another law. We've seen what it has done in Colorado, but now they have, recreational marijuana legalized, and, this is just another bite of the apple. This is supposed to be about sick people, if you remember way back in the beginning. Now it's for everybody, and now it's even, okay, let's get, the market is going to basically say, let's get people younger and younger. If we can get them addicted, and if we get someone addicted, by the age of 18, we can have a lifelong customer. That's what's so frightening about this. So the Marijuana Policy Project will do this. We'll come out and try to do this, and we just have to hopefully they won't get signatures, and because our campaign team is basically working for the presidential campaign and all the campaigns around Ohio. So we would have to do this ourselves. So God bless us. There's another one. The Marijuana Policy Project, a little bit of the issue comes with to do this, you'd have to be 21 years old. You get 2.5 ounces every 14 days. Basically, it's 150 joints you would be able to get. in 14 days, even if that is 6 a day, if you're up 24 hours a day for 14 days, which I think is pretty impossible. 6 a day times 14 is not nearly 150. I think that's like 84. So you'd have all of these all of this extra marijuana. We're worried about the diversion from that. They don't identify a number of stores. You could have 1 million stores at this point. They do have a business plan. Sounds a little bit like the Responsible Ohio plan. 15 individuals will become type 1 growers and distributors. They would have to put up $500,000 up front. They could start growing. They would get a jump start on anyone else. And it would be limited to 15 individuals. That's what it says, right? That's what it would say right in the Constitution. And they would have to be able to live a year without a paycheck, which is interesting. There's also a type 2. It's an unlimited number of individuals, but you'd have to pony up 5,000. But you wouldn't be able to start growing until November 1st. So the big guys get a 3-month head start on you. And dispensaries will not open until February of 2018. There's no local control. You cannot prohibit dispensaries. You can also not prohibit any kind of transportation of marijuana in your locality. So there are some issues that we really have with this. And again, this is nothing more than legalization. The number of ailments that you have on this are just, I think I counted there were like 26 of them. They actually added 4 more that have no medical proof or background to why you would add these things. It's just a grab to try to get some votes. So this is something that does concern us, and we'll be continuing to look out. And as coalitions and individuals across your state, you need to educate folks that we don't do medicine this way. We do it through an FDA and scientific process. I don't know why we're trying to do it through voter initiative. Another group called Grassroots Ohio also got their ballot board approval, and basically they're called Grassroots Ohio. They're an advocate and grassroots-driven organization. It literally is a page long. What they want to do, I talked to the guy, Aaron Weaver, who helped write this thing. Basically, they want to just have the right to use medical marijuana in the Constitution. They say the Constitution is a rights-driven document, and they don't care about how much you have. They don't care about what your issues are. They don't care about how things are administratively carried out, but what they just want is that you're allowed to use it and let the General Assembly figure it out later. They do have, they want to remove marijuana from the Schedule I list in Ohio. Kids could get it without parental consent. The other interesting piece that really the whole licensed physician thing, it's not it's not a whole recommendation. It's just that you would be able to get a have an ailment, and who doesn't have an ailment to get this? So it's just kind of a kooky document. I don't think is going to go anywhere. Again, they don't have any money. They don't have any other than a bunch of folks who are kind of tied to this movement. They don't have a whole lot else going on. And then also there's a House Marijuana Task Force that ended, I think, the 31st was the last hearing of March. We're hearing, maybe, we don't know, that there might be a bill introduced from this task force. I know they have to have a report due by May 1st. And to the Speaker, and then there will be a determination about whether a bill would be introduced. The Senate side had a listening tour. They also, will there be a bill introduced? Senator Kenny Yuko said he wants to introduce a bill. It would be much like the folks with the Marijuana Policy Project, very, very liberal in the number of ailments, not a whole lot of controls. But would there be any movement on this if Senator Yuko, because he's a Democrat in a supermajority Republican Senate? I don't know. I seriously doubt it. I would look more at the House bill if it were introduced. than the Senate bill. But that's just that's just my 10-cent piece. So, and then finally, we have a lot of opportunities for folks to get trainings and to get some hours and to get a lot of opportunities. There will be a zero suicide training taking place today and tomorrow, and there's another one in May that you can apply for. If you have a excuse me, if you have any kind of interest in preventing suicide, as a suicide prevention campaign. April 28th, we have our Ohio Youth-Led Prevention Network Youth Rally down here in Columbus. We're going to have somewhere between 1,650 and 1,700 young people that will be marching from the from COSI and Genoa Park to the Statehouse, which should be it'll be the biggest rally we've ever had, which is good. And so if you, I think registration was closed, but I think if you twisted Tristan's arm, you might be able to get a couple more kids in. Also, May 2nd and 3rd, down here in Columbus, we would have we are not having, the Ohio Association of Behavioral Health, County Behavioral Health Authorities, OACBA, is hosting the Opiate Conference, which has been a very well-attended conference the last couple of years. That's happening on May 2nd and 3rd. May 4th, the ADAPO conference will take place at the boathouse where it is normally held at here in Columbus, Ohio. That should be a good day for prevention professionals. May 17th, we have a big SPECA meeting, which you'll be getting some details on and hoping for some big things there. So we look forward, and there's always a lot of great conversation there. And I know that as far as advocacy, I love to hear from everyone as far as we are, getting our voice together and those types of things. I love to hear what folks have to say. June 1st and 2nd, there's a recovery conference that OACBA, the Boards Association, will also be hosting here in Columbus. There will also be on June 27th through 29th, the OPEC conference will be taking place at Ohio University, so make sure that you sign up for that. And then there will be a prevention ethics course. I just got this note someone gave us at ADAPO on May 4th. Oh, the 5th. Oh, so it's after the ADAPO conference. So prevention ethics will be trained there. So if you need those hours, it's a great place to get those, and I'm sure that's on the ADAPO website. Didn't know if there were any questions. I am running out of time, so I will try to get you more information on the MBR bill and the House Bill 248 in the next day or two, and we'll do a recap for you, and if there are no questions, then we will move on. And thank you so much for all the work that you're doing. And I tell you what, you're making a difference. And we're going to turn the tide on this opiate crisis. And I really look forward to again working with you in the fall, or in the summer and the fall on this. One more thing, I will be going to. We will be represented at the United Nations next week. I'll be attending the United Nations special session on global drug policy, and we'll be going there representing, basically there's a group of folks who are trying to legalize all drugs around the world, so they'll be looking at international drug treaties and drug policies and those types of things. I was invited to be there, and am looking forward to that, so I will have an update from that on our next advocacy call and at our next SPECA meeting. So we are, I don't think, have any questions or anything, and we look forward to talking with you next time. Thanks.